So, students, we all were talking about the applied hematology. Till now, we all have seen the means what is the scope of applied hematology. We had also discussed about what test we can do for the blood. Now, see, when we were talking about the clinical significance of diagnosis theory, that time we were learning about the various type of the test, and we have already discussed about the microscopic examination of the blood. So microscopic examination of the blood, in that we all have seen that how could we collect and process the blood sample, then preparation of the blood films. Now today we will discuss about the diseases, and we will see that how this diseases affects the human. So we are going to learn about the disease. We will talk about its symptoms. We will talk about diagnosis and treatment. So today the disease we are going to talk about, as you all can see on my screen, is the blood cancer. So when we talk about the blood cancer, so generally the blood cancer is called as the leukemia. You can say it's a cancer or it could be a tumor. So this blood cancer affects the blood. Now we say it's a blood cancer, but it not only affects the blood, it affects the bone marrow, it affects the lymph and the lymphatic system. Now see students, we all have learned in detail about the hematology. We all have seen that, and also we all have studied about the circulation depth study in SYBSC. So we all know about the circulation very well, that in the higher organism. Now human belongs to the most complex higher organism, so their cardiovascular system and lymphatic system are the two different systems, right? So these two systems are separated, they have their own vessels. That means the cardiovascular system, they are connected with the blood vessels, and when we talk about the lymphatic system, so they have the lymphatic duct. So different vascular systems are there, but the blood cancer, when it affects, it causes. So this blood cancer, it spreads. Now see the chances of metastasis in the blood cancer is highest. Now we will learn some term: oncogen, metastasis, as well as the type of cancer. So oncogen is the gene which is present in the human in active state. Okay, when this gene get activated, it start proliferating the cells. Uncontrolled, undeveloped growth of the cell is called as the cancer. Cancer is of two types: benign, malignant. Benign cancers are also called as harmless. They are just tumors. Now, this benign cancer can turn to the malignant cancer if it is uncured for the longer time. So this cancer will become malignant. Malignant cancers are the transformed cells, means they are transformed. See children, transformed means they have lost the state of the functionality. When we talk about the body cells, so all the body cells are terminally differentiated cells. Students, you all remember I have used this term previously also. Terminally differentiated cells means the body cells, the body somatic cells, they are terminally differentiated cells, means their task is to function. They have a particular lifespan, they do not divide. previously also I told you there are only and only stem cells which divides. Whatever mitosis we all have learned, it do not occur into the normal body cells. All normal body somatic cells are terminally differentiate cells. Then when their lifespan overs, they die. Then how these cells get recovered? So I told you about the stem cells, you all remember. So this stem cells function is to divide, and this stem cells rejuvenate or reforms the new cells which are died. So children, these cancer cells, these transform cells, they work, they behave like the stem cells, that but they are having the self sufficiency meaning they do not require any. Now see, stem cells, they required a signal, that's when so cells are died, so new cells production has to be done. But these cancer cells, they are self-sufficient, they do not require any type of signal to divide. They keep on dividing, keep on dividing, keep on dividing. Means they're such a foolish fellow, what is happening into the body they are least bothered. They don't care what is happening in the body. They keep on dividing, increasing their number. Understood? So these type of cells, when they colonize to a particular area, they will be termed as the tumor. But sometimes it forms the tumor into the blood vessel. At the time when they separate, even if a single cell which is transformed or which is carcinogenic in nature, so if it will go to the new place, it will start the secondary cancer. So primary cancer is the place where the cancer has been started, and the place where the new infection, suppose the blood any chance anyhow has entered into the bloodstream, and suppose the person was having the breast cancer, and from the breast the anyhow the cell has entered into any lymphatic system or the blood system and entered into the X organ. So now in the X organ the new cancer will be developed. So the primary cancer is the breast cancer. Now X organ cancer will be the secondary cancer. So the spread of cancer from one localized place to the another organ is termed as metastasis. Now blood cancer. Come back to our own topic, that is leukemia or the blood cancer. Children, when blood cancer happens, now we all know that blood is having access to all organ, right? So can you imagine how much chances the blood cells which are means totally we are relying, our body is relying for its nutrient, for its oxygen transfer, for its immunity, for its respiration, for its removal of metabolic wastage, for everything. Our body is relying on what? Blood only. Blood is the only and only transport system in our body. So when this blood is helping body so much, it's transporting so many things. If its cell, its own cell will get transformed, will turn into the cancer cell, so what will happen? It will increase the rate of metastasis, metastasis, highest spread of cancer is caused in the case of the blood cancer. If a person gets the blood cancer, has the highest chance of getting each and every body part cancer. So this is the very worst cancer amongst all cancer, because it spreads, and basically in general it is said that science is handicapped to treat the blood cancer, and it is very difficult to treat the blood cancer. Up to some extent it is uncurable. So when we talk about the blood cancer, so there are various type of blood cancers depending on the type of cells involved. Like if it involves the myeloid cells or the lymphoid series, it also depends on the course taken by the disease. Leukemias are of several types. Two types we are going to discuss today: lymphoma and myeloma. But in that also acute, chronic, many. It's a very vast and deep studies. Student, if I will teach you entire day without stopping, that means 24 hours about the blood cancer, the information given to you will be absolutely insufficient. So it is a very vast topic. We all are not going to learn in so detail. We will restrict ourselves to the syllabus part. We will just discuss about two types of cancer. One will be the lymphoma and another will be the myeloma. Let us discuss about the lymphoma. Now, name itself is suggesting that lymphoma is a type of blood cancer that develops from what idea we get lymphoma. That means the lymphocytes. So this is the cancer which develops from the lymphocytes. There are different subtype of lymphomas like lymphomas, leukemias are the part of broader group of tumor of the hemopoietic and lymphoid tissue. Now, lymphoma, lymphoid cells, which are the hemopoietic. So, signs and symptoms when we talk about now, what would be the sign and symptoms? So, its sign and symptoms include presence of enlarged lymph node. Now, lymph node, you all remember, we all have studied into the immunology. So, in that, we all have learned that the lymph node are the junction, or you can say the headquarter of the secondary immune response. That means it is the pavilion where the lymphoid cells they are preparing the immunity of the body. You all remember. So here, what is going to happen in the case of the lymphoma? In the case of the lymphoma, the lymph nodes will enlarge. That means they are going to be swollen. Then person will get fever, drenching night sweats, weight loss, itching, constant feeling of tiredness. Like symptoms are associated, and the person will also feel loss of appetite. Means the person will not at all feel hungry. Anorexia, it is the respiratory problem. Then fatigue, tiredness, respiratory distress, dyspnea, many other problems are associated with all such problems. Then thereafter, diagnosis. How can we diagnose? Diagnose means, see, when we talk about diagnosis in the pathology or hematology applied sciences, that means the finding or main root cause, finding the main root cause of a disease. So how can we find? So diagnostic technique, it involves biopsy of partial or total excision of a lymph node for examination under the microscope. Okay, we all know that we all are studying this topic under the head of the microscopic examination of the blood. So what can we do? Biopsy. Biopsy means removal. See, general meaning of biopsy I'm talking about. Biopsy related to lymphoma I will discuss later. Biopsy means removing tissue by surgery from a particular infected area. Now, why do we do biopsy? Why do we remove the tissue? So we remove for the histopathology study, for various type of study, or sometimes we grow it into the media to check the malignancy of particular tissue. So here, what can we do? We can do the biopsy of partial or total excision of the lymph node for examination under the microscope. Now, see, this is very important to remove a particular lymph node which is affected, which is swollen, which is enlarged, and thereafter they do the microscopic examination. It includes the histopathology. Histopathology means they may do the processing of that particular tissue. This involves the various steps. They make the tissue then suitable for the slides, then they make the perfect slides of that particular tissue, and they observe it under the microscope, and they remark that how much changes occurs from the normal cell. Then the second is the magnetic resonance imaging, MRI. You might have heard multiple times. It is a very common nowadays. So MRI may be done to determine the spread of cancer. They do the MRI, they check that this particular type of cells where other places they reside. Then most often, this lymphoma spread through the lungs, liver, brain. So these three places are very much susceptible for the lymphoma attack. The lymph node biopsy examination maybe reveal the histopathological features that may indicate the lymphoma. If diagnosed, now what to do? So if it is diagnosed that yes, that the person is having the lymphoma, so they do the additional tests to ascertain the type of lymphoma. I told you that we are studying the broad aspect. There are various type of lymphoma also, which we all are not going to discuss today. A complete blood count they do, that is the CBC, that measures the level of different cells into the body, means sorry, different blood cells, not different cells. So see what happens if the person will get lymphoma, so its blood count will differ. Now we know complete blood count means if a person's, even if we are having some small problem, it's a fever or anything, doctor suggests do the CBC. So this complete blood count is related to the medical situation of a person. So doctor asks for the CBC. A low blood cell count may indicate that the lymphoma is growing in the bone marrow and affecting new blood cell formation. But if it is means lymphoma, if a person is having, that means lymphoma is going to attack on the hemopoiesis process. What is hemopoiesis? Hemopoiesis is the process in which the new blood cells form. So if the person will get lymphoma, what is going to be happen? It is going to affect the bone marrow stem cells. So automatically by default, naturally the person's CBC, that is complete blood count, will reduce. Then what other test we can do? We can do the chemical tests like kidney functioning test, liver functioning test. Now see why we are doing biochemical tests like KF. Have you heard about KFTs and LFTs? That is the kidney functioning test and the liver functioning test. Why there is a need to check it? Because it affects, I told you, that the various organ. So kidney and liver function signs, if cancer has reached to the bone, then lymphoma is diagnosed. Then the lactate dehydrogenase level is also being checked, which often increase in the patient with lymphoma. So all this functioning, all the organ functioning is being checked whether they are affected or not. Then erythrocyte sedimentation rate is also suggested to do, because it also done to measure the progress of the disease. If the disease has progressed, so definitely it is going to affect the ESR also. Now, what treatment can be done? Now, what is the treatment of cancer? We all know very well. More, see, sometimes we do one treatment or more than one. So, more than like chemotherapy along with radiation is done. Sometimes radiation along with the targeted therapy is done. So, combination of treatment can also be done to treat. So here in the case of lymphoma treatment, every cancer, I am talking generally about the cancer, that in any part of the body is transformed or a person got the cancer, so usually that particular doctor first try to do the surgery and remove that cancer, remove that tumor, right? Then after that, the combination of effect is done. Sometimes radiation, they do the radiation and check whether the all cells are being killed or not. But if it is not, then they add on with the chemotherapy, then targeted therapy. So like this combination means treatment is done in the case of the cancer. So for specifically when we talk about the lymphoma, here also case is same, one or more treatments such as chemotherapy, radiation therapy, targeted therapy like surgery. In some lymphoma, increased amount of protein produced by the lymphoma cell. So this causes the thickening of the blood. So excess protein removal is actually very important. So this excess of protein is removed by the plasmapheresis. I repeat, it is the plasmapheresis. The term plasmapheresis means removal of excess protein from the blood. Then this is all about the lymphoma. Let us discuss about the second type of cancer, that is the myeloma. Now, when we talk about the myeloma, so myeloma is the plasma cell myeloma. It is all myeloma is, it is also called as the plasma cell myeloma. It is a cancer of the plasma cell. Now, see, previously we all have seen about the lymphoma that it is the cancer of the bone marrow cell. This is the cancer of the plasma cell. So, type of white blood cells normally which are responsible for the producing antibodies. Now we know these are the immunoglobulin. So when we talk about the symptoms, so its symptoms include the bone pain, bleeding, frequent infections, and anemia. Anemia will definitely occur because it is affecting the plasma cells. Then another common finding is high blood calcium level. The disease mechanism involves the production of abnormal antibodies produced by the abnormal plasma cell, which causes the thickening of blood. Now, when thickening of blood will happen, we know that the same blood reaches to the kidney. So definitely it is going to cause the kidney disorder. The disease also involves formation of the mass of plasma cells in the bone marrow or the soft tissue. Now this mass will create what? This mass will create the coagulation, right? Congestion, we use general term. Then occurrence of more than one mass of plasma cell is known as multiple myeloma. I repeat, when we find more than one plasma cell masses, so these masses will be known as the multiple myeloma. Now what are the signs and symptoms? So when we talk about the sign and symptom, it varies depending on the affected organ. If the organ is affected is the bone, so bone pain is the most common symptoms affecting approximately 70% of the patient. Myeloma bone pain usually involves the spine and ribs, worsen with the activity. Now see, ribs and spine, you need to remember. So when the person is getting more and more affected, so more and more spine and rib pain will occur. Then persistent localized pain may indicate pathological bone fracture, which release calcium into the blood, and this will cause the hypercalcemia. Now what is going to be happen? See, biological bone fracture, biological or you can also call it as a pathological bone fracture. Pathological bone fracture means the bone is getting affected within. Okay, so because of the pathological condition, because of the blood condition, the person's bone small part will be fractured, and this fracture will cause the release of calcium. Now, where this calcium will go? Definitely, this calcium will enter into the blood, and what will ultimately happen? This will increase the blood calcium level. Now, the condition of increase of the blood calcium level is called as hypercalcemia. The anemia myeloma is usually normocytic and normochromic. So this results from the replacement of the normal bone marrow by the infiltrating tumor cells. Now what is happening here? Normal bone marrow is changing with the tumor cells and inhibiting of the normal red blood cells RBC production. Now kidney failure is the ultimate cause of the death of a person I'm talking about. Now diagnosis. How can we find the presence of the unexplained anemia, then kidney dysfunctioning, high rate of ESR, bone fractures, and or a high serum protein, especially raised globulin or immunoglobulin, may indicate the myeloma. Now, myeloma blood test involves examination blood for total protein, then kidney functioning test, CBC I had already discussed is a complete blood cell count, then calcium level, uric acid level. Multiple myeloma testing is important in the diagnosis of the disease and also designing and monitoring the treatment. Until and unless we are not checking all these things, so we cannot come to the conclusion. In myeloma, excess bone marrow cells occur with a low RBC count. Matlab, what is happening here? That bone marrow cell is increasing, but RBC is decreasing. Why? Because these bone marrow cells are not the actual bone marrow cells, which are responsible for the production of the new blood cells. They are the cancer cells. So these are the infiltrating cancer cells which are replaced by the normal cells. So for that particular reason, the bone marrow cells will not be able to produce the bone cells. This will produce the cancer cells now. Now, what treatment? Now, myeloma is generally incurable. Treatment with the steroid, chemotherapy, then stem cells transplant, plasmapheresis. Plasmapheresis, just now I told, removal of the excess protein from the body, and radiation therapy. Then chemotherapy is accompanied by administration of drugs such as bisphosphonate, drug for prevention of loss of bone density. Like these things can be done. So this is all about the blood cancer. Next lecture we will discuss about the infectious disease. So for this particular note for today, we'll stop now.